Welcome to Nurse Talks. Today's topic is hypoxia. Hypoxia versus hypoxemia. Hypoxia is the low level of oxygen in the tissues, whereas hypoxemia is the term which indicates low level of oxygen in the blood. When the total amount of arterial oxygen level is zero, it is called as anoxemia. Cyanosis is a symptom of hypoxia, which is the bluish discoloration of the skin and the mucous membranes. Why oxygen is needed for a body? In cellular respiration, our cells use oxygen to break down the energy stored in glucose to store it in ATP for later use. How carbon dioxide is produced in our body. The waste product our cells produce in the process of breaking down of glucose is carbon dioxide, which our bodies need to get rid of. So, respiration is the process which helps oxygen to bring to the cells and removes the waste product carbon dioxide. Respiration is nothing but exchange of oxygen and carbon dioxide during cellular metabolism. There are three steps involved in the process of oxygenation: ventilation, perfusion, and diffusion. Ventilation is nothing but the process of moving gases into and out of the lungs. The oxygen which is present in the atmosphere will enter into the lungs, and carbon dioxide will be removed from the body through the lungs into the atmosphere. This process of exchange of gases is called as ventilation. Next is perfusion. It is the ability of the cardiovascular system to pump oxygenated blood to the tissues and return deoxygenated blood to the lungs. The oxygen which has entered to the lungs will enter into the heart through the pulmonary veins. From the pulmonary veins, the blood will enter into the right atrium, then to the right ventricle, and is carried to all the parts of the body by aorta. Whereas the deoxygenated blood from all the parts of the body will be carried on to the heart by the superior vena cava and the inferior vena cava. From the heart, the deoxygenated blood will enter into the lungs through the pulmonary arteries, from where it is expired out. Diffusion. It is the process of exchange of respiratory gases in the alveoli and the capillaries. What are the causes of hypoxia? Decreased hemoglobin level and lowered oxygen carrying capacity of the blood. Hemoglobin is the pigment which is present in the RBC that carries oxygen. A diminished concentration of inspired oxygen which occurs at high altitude. In certain cases, if the presence of oxygen in the atmosphere is less in concentration, that causes hypoxia. The next is inability of the tissues to extract oxygen from the blood, as with cyanide poisoning. Oxygen may enter into the lungs, but the tissues may not be able to utilize it, as in case of cyanide poisoning, because the tissues is poisoned with cyanide. The next is decreased diffusion of oxygen from the alveoli to the blood. In this case, the alveoli where the gas exchange will take place will be filled with fluid because of pneumonia, thereby the diffusion of the gases is reduced. Poor tissue perfusion with oxygenated blood, as in case of shock, the circulation will be reduced. Impaired ventilation due to some causes, maybe because of the dysfunction of the medulla oblongata or the respiratory passages, the ventilatory function of the lungs will be reduced. This is the oxygen transport system. Oxygen from outside the body is drawn into the lungs through the respiratory passages. The oxygen travels to the alveoli in the lungs, where it moves into pulmonary capillaries. In the pulmonary capillaries, the oxygen gets drawn into the blood, binding to iron molecules in the blood's hemoglobin. Here, the blue blood vessels indicates the blood vessels that are carrying deoxygenated blood, and those colored red indicates the blood vessels carrying oxygenated blood. The oxygenated blood from the lungs enters into the right atrium through the pulmonary veins, which are 4 in number. From there, it enters into the left ventricle, where it is carried to different parts of the body by the greater blood vessel aorta. And the oxygen is delivered to the tissues. And the waste material which is produced by the tissues is carried back to the heart by the inferior vena cava and the superior vena cava. And this blood is delivered into the right atrium. From the right atrium, it will come to the right ventricle. From the right ventricle, it is delivered to the lungs by the pulmonary artery. And in the lungs, it is expired out. This is the short process of respiration and the deliverance of oxygen to all the body tissues. Once oxygen has entered the blood from the lungs, it is taken up by hemoglobin in the red blood cells. Each molecule of hemoglobin can hold 4 oxygen molecules. Oxygen is poorly soluble in blood, and so only a tiny amount of oxygen, that is 1.5% in arterial blood, is dissolved in the plasma. The overwhelming majority is bound to hemoglobin and is dependent on this to reach the tissues in adequate volumes. The percentage of oxygen bound to hemoglobin is related to the partial pressure of oxygen at a given site. It explains how when the oxyhemoglobin reaches a tissue that is using oxygen, for example, skeletal muscle, the oxygen will dissociate because of the lower local partial pressure of oxygen. This system allows oxygen to be delivered to the areas that need it most. Here we have to understand one thing. Wherever the partial pressure of oxygen is low, there the hemoglobin which is bound to oxygen, called as oxyhemoglobin, will dissociate. It dissociates means it separates. When it separates, it is separated into oxygen and hemoglobin. This here dissociated oxygen is delivered to the tissues. But under one condition, the partial pressure of oxygen should be low. And this is the condition which is taking place in the skeletal muscle, thereby oxygen is used up. But in cases where the oxygen concentration of the blood is high, especially in case of lungs, where it is highly filled with oxygen, this dissociation will not take place, but it will bind to the hemoglobin. This is a simple process of deliverance of oxygen at tissue level. Types of hypoxia. Hypoxic hypoxia, where the partial pressure of oxygen of the arterial blood is low. Anemic hypoxia, where the amount of hemoglobin to carry oxygen is low. Stagnant or ischemic hypoxia, blood flow to the tissue is low. Histotoxic hypoxia, tissue can't utilize oxygen. Hypoxic hypoxia, the causes are high altitude. As the altitude increases, the oxygen concentration decreases. When the oxygen concentration is decreased, the amount of inspired oxygen is decreased, resulting in hypoxia. Second is respiratory muscle paralysis. Respiration is helped with respiratory muscles and diaphragm. When these muscles are paralyzed, the air cannot enter into the lungs, resulting in hypoxia. Obstructive lung diseases like COPD. In this case, lung function is obstructed like bronchiectasis and asthma, etc., resulting in hypoxia. Restrictive lung disease like pulmonary fibrosis and pneumothorax, which restricts or reduces the function of the lungs. The lungs will not be able to expand, thereby air cannot enter into the lungs. Next cause is depression of respiratory center. The respiratory center is medulla oblongata. If this respiratory center is depressed in case of certain diseases like head injury or tumor or anything, or maybe because of some drugs like narcotics, the respiratory center will not be stimulated, so that the respiratory rate will come down, resulting in hypoxia. What happens in this case of hypoxic hypoxia to the arterial partial pressure of oxygen? The arterial partial pressure of oxygen is reduced in this case, but in other types of hypoxia, the PO2 remains normal. Anemic hypoxia. Arterial partial pressure of oxygen is normal but inadequate oxygen carrying capacity of the blood. The arteries PO2 remains normal, but the oxygen carrying capacity of the blood is reduced because of reduced hemoglobin concentration or abnormal types of hemoglobin like methemoglobin or hemoglobin S. Or in case of carbon monoxide poisoning. In case of carbon monoxide poisoning, hemoglobin has more affinity to carbon monoxide, 200 to 300 times more affinity to carbon monoxide than oxygen. So, oxygen will not have any hemoglobin to bind with, thereby resulting in hypoxia. The next type is stagnant hypoxia. This occurs at circulatory level. The ventilatory function is not affected, but the circulatory function is affected. It is a condition that interferes within the normal circulation of blood arriving at the cells. Example of this is an arm or leg going to sleep because the blood flow has accidentally been shut off is one form of stagnant hypoxia. We would have experienced this when we are sitting continuously on the floor. We may feel that our leg is numb, and sometimes this may result in hypoxia, stagnant hypoxia. This type of hypoxia will be present in case of heart failures also. Histotoxic hypoxia. This type of hypoxia occurs at cellular level. There is no problem in ventilation, there is no problem in perfusion also. But there is some problem in the cell. The tissue cells are poisoned. This occurs at cellular level, interferes with the normal utilization of oxygen into the cells. Plenty of oxygen is being transported to the cells that need it, but they are not unable to make use of it. Tissue cells are poisoned and unable to use oxygen. This is mainly caused by alcohol and drug, and one important example is cyanide poisoning. Here, more amount of oxygen will enter into the lungs. At the same time, more amount of oxygen will travel to the tissues also. But the tissues will not be able to take up this oxygen which is delivered to them because it is already poisoned with something else like alcohol, drug or cyanide. Now this is the question section. A nurse working on a pulmonary unit is alert to one of the early signs of hypoxemia in patients, which is cyanosis, decreased respiratory rate, decreased blood pressure, restlessness. And the correct answer is restlessness. This is the early sign of hypoxemia. Those cyanosis and decreased respiratory, those are the very late signs of hypoxemia, but the early sign is restlessness. The primary respiratory control center is medulla oblongata, cerebrum, cerebellum, pons. And the answer is medulla oblongata. Next question. The nurse is reviewing the arterial blood gas results of a client with a respiratory disorder. Which of the following would alert the nurse to a problem? A pH of 7.35, PaCO2 of 55 millimeters of mercury, HCO3 of 25 milliequivalent per liter, PaO2 of 92 millimeters of mercury. And the correct answer is PaCO2 of 55 millimeters of mercury. A PaCO2 below 35 or above 45 millimeters of mercury is considered abnormal and indicates a problem. The normal PaCO2 level is 35 to 45 millimeters of mercury. The PaO2 and bicarbonate levels are within normal parameters. That is, normal PaO2 is 80 to 100 millimeters of mercury and bicarbonate level is 22 to 26 milliequivalent per liter. And pH is also within normal limit, that is 7.35 to 7.45. The next is A client is receiving supplemental oxygen and the nurse is monitoring the client's oxygen saturation level using pulse oximetry. The nurse notifies the physician if the client reaches which oxygen saturation level: 98%, 92%, 94%, 96%. And the correct answer is B, 92%. An oxygen saturation level less than 93% usually indicates the need for increased supplemental oxygen. Though the normal SpO2 is 95% and above, an exemption can be given up to 93%. If the saturation level comes down below 93%, supplemental oxygen should be started. The client is receiving oxygen therapy via a nasal cannula at 3 liters per minute. The nurse estimates that the client is receiving which concentration of oxygen: 26%, 34%, 30%, 22%. And the correct answer is 30%. Here, rule of 4 has to be used. For each liter per minute, the oxygen concentration is increased by 4%. The basic 1 liter. The basic is 1 liter per minute provides 22% of oxygen. From there onwards, from 22 onwards, for each liter of increase, we have to add 4%. That is, 2 liter per minute provides 26% of oxygen. 3 liter per minute provides 30% of oxygen, and 4 liters per minute provides 34% of oxygen. Which of the following is a result of hypoxia? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. And the correct answer is metabolic acidosis. When the oxygen concentration is low at cellular level, that causes anaerobic glycolysis. The glucose will break down in the absence of oxygen, and the resultant is lactic acid, which increases. When the lactic acid concentration is increased, that results in metabolic acidosis. In ICU and other patients without respiratory disorder may develop hypoxia, that is oxygen saturation less than 90%, during a hospital stay. A very sudden onset of dyspnea and hypoxia suggests which of the following? Pulmonary embolism, pneumonia, pulmonary edema, cardiogenic shock. And the correct answer is pulmonary embolism. Very sudden onset dyspnea and hypoxia suggests pulmonary embolus or pneumothorax, mainly in a patient on positive pressure ventilation. Other cases there may be hypoxia, but those are gradual in onset. But in case of pulmonary embolism, hypoxia is sudden in onset. In addition to hypoxia, there will be dyspnea also. A patient with hypoxia also has distended neck veins. Which of the following suggests a diagnosis of tension pneumothorax rather than acute valvular insufficiency? Fever, tracheal deviation, decreased mental status, low extremity edema. The correct answer is tracheal deviation. Distended neck veins with clear lungs or unilateral decrease in breath sounds and tracheal deviation suggest tension pneumothorax. Distended neck veins with bilateral lung crackles suggest acute valvular insufficiency or volume overload with pulmonary edema, cardiogenic shock or pericardial tamponade, often without crackles. A patient with COPD is unable to perform activities of daily living without becoming exhausted. Which nursing diagnosis best describes this alteration in oxygenation as the etiology? Decreased cardiac output related to difficulty breathing, impaired gas exchange related to use of bronchodilators, fatigue related to impaired oxygen transport system, ineffective airway clearance related to fatigue. And the correct answer is fatigue related to an impaired oxygen transport system. It is an example of nursing diagnosis with alteration in oxygenation as the etiology or cause of other problems. Next question. What action does the nurse perform to follow safe technique while using a portable oxygen cylinder? Checking the amount of oxygen in the cylinder before using it. Using a cylinder for a patient transfer that indicates available oxygen is 500 psi. Placing the oxygen cylinder on the stretcher next to the patient. Discontinuing oxygen flow by turning cylinder key counterclockwise until tight. And the correct answer is A. Checking the amount of oxygen in the cylinder before using it. The cylinder must always be checked before use to ensure that enough oxygen is available for the patient. It is unsafe to use a cylinder that reads 500 psi or less because not enough oxygen remains for the patient transfer. Thanks for watching. If you like the video, please like, share and subscribe.